Good day, everyone. Good day, Doc. Today, our group is going to talk about the microbial infections of the oral cavity, particularly oral thrush.
We're going to discuss the etiology of oral thrush. The main cause of oral thrush is the overgrowth of a type of fungus called Candida. Candidiasis is a fungal infection caused by a yeast, which is a type of fungus that is supposed to be present in healthy people that normally lives on skin and inside the body such as mouth, throat, and gut without causing any problems. Candida can cause infections if it grows out or if it enters deep into the body. Oral thrush happens when a yeast infection develops inside the mouth. It mostly occurs in the infants and toddlers. It causes white or yellowish bumps that form on the inner cheek and tongue. The infection are caused by an overgrowth of the fungus called Candida albicans. It's normal for a small amount of Candida albicans to live in our mouth without causing any harm. When the immune system is working properly, beneficial bacteria in our body help keep Candida albicans under control. But if the immune system is compromised of the balanced microorganisms, the body will disrupted. The fungus can grow out of control, and it may develop an overgrowth of Candida albicans that causes oral thrush.
Let us now move on to the structure of organism. Candida albicans grow on the mouth's lining in oral candidiasis, sometimes referred to as oral thrush. On human bodies, a fungus called Candida albicans is present by nature. Small amounts of yeast, a type of fungus, are frequently found on our skin, in our intestines, and our tongue. The structure of Candida albicans are composed of blastospores, pseudohyphae, and chlamydospores. Blastospore, a fungal spore that is produced by budding and that acts as a resting spore or gives rise to another spore. Pseudohyphae is for budding pattern, cell elongation, and cell adhesion, while chlamydospore is primarily for the fungal's survival.
For the morphologic structures, the cell Candida albicans appear small and oval in shape with a diameter of 2 to 4 micrometers. It is also a unicellular cell or a single-cell yeast type which it reproduces through budding. So budding is actually an asexual form of producing new organisms. A new organism is developed from a small part of the parent body. A bud that is formed will detach to develop into a new organism. Candida albicans are multifaceted fungus. Its cell walls comprise 80 to 90% carbohydrates, so that's obvious since Candida albicans is a yeast type and yeast is a carbohydrate. So this is a photo of Candida albicans derived from a real organism. As we can see, it shows an oval shape, and we can observe there the budding process where there is clearly a bud, the new organism being formed, but it's still attached in the parent body.
Oral thrush formation is caused by a yeast fungi called Candida. The most common species in Candida is the Candida albicans. It is an opportunistic pathogen for some immunologically weak and immunocompromised people. Candida albicans is transmitted by direct contact with contaminant people or objects. Candida becomes a pathogen if a patient's immune system is compromised following surgery or chemotherapy, for example, as a result of the disease. People with dysfunctional host immunity are infected by this opportunistic organism.
So, since oral thrush is caused by opportunistic organisms, people with dysfunctional or has issues in their immune system are susceptible to infection. Number 1 is suppressed immune system or immunodeficient. Immunodeficiency is one of the most risk factor for getting oral thrush because their immune system is not functioning well. Example is person infected with HIV. Age is also a risk factor for oral thrush. Neonates or newborn have naive immune system, meaning their immune system hasn't fully developed. Old age also is a risk factor. As individual gets older, the immune system weakens and add risk of getting this disease as well. Comorbid conditions includes diabetes and smoking. This condition increase the risk because they can cause immunosuppression. Malnutrition is also a risk factor. Being deficient in certain vitamins can increase risk in oral thrush. And lastly, medications. The use of antibiotics kills normal bacteria in the mouth, and that normal bacteria in the mouth compete with candida so that the candida doesn't grow out of control.
The discussed risk factors can disrupt the normal flora of the body, an opportunity for the Candida species to reproduce. It will result to the overgrowth of Candida albicans in the mouth. It will then begin to adhere in the epithelium and leads to the desquamation of epithelial cells. After damaging the epithelium, they penetrate the tissues and invades the vascular system. The localized infection will then activate the coagulation cascade. The pseudomembrane will then appear in the mouth that is white, opaque, patchy plaque on the tongue or buccal surface.
Moving on to clinical manifestations. Oral thrush presents as white, opaque, and patchy plaque on the tongue or inner cheeks. Occasionally, they are seen on the roof of the mouth, gums, and tonsils too. These plaques are excessively sticky to the infected surface, and when it is scraped off by a tongue depressor, it will reveal a red and inflamed area. For patients, this can be painful and have the potential to bleed. Some observations in the area are redness, soreness, or burning sensation that may be intense enough to promote difficulty in swallowing. The third one is denture stomatitis. In this localized infection, there is a high concentration of candida. There are signs of redness, inflammation, and discomfort underneath the dentures. Denture stomatitis is also frequently termed as denture sore mouth and prostatic stomatitis.
The signs for oral candidiasis are loss of sense of taste, angular cheilitis, and esophageal candidiasis. The white plaque due to the overgrowth of the yeast-like fungus, it actually covers the taste buds of our tongue, and it is causing the loss of sense of taste. The taste receptors, which is actually found in our tongue, won't be able to sense various chemical compounds in foods. Thus, it cannot transmit these kinds of signals through the gustatory nerve fibers, which will be connected or be leading to the central nervous system. This would also lead to the lack of appetite, causing people to eat less and also to lose weight. Angular cheilitis is a condition that causes red swollen patches in the corners of our mouth. Oral thrush can also coexist together with the angular cheilitis. Since there is rampant growth of candida in the tongue and also in the cheeks, it would most likely lead to the warmth and moisture in the corners of your mouth would create the perfect condition for the fungus to grow and to multiply. Sometimes oral candidiasis spread to our esophagus, which is the tube that connects the throat to the stomach. It is actually causing pain in swallowing and also difficulty in swallowing. Due to the impaired cell-mediated immunity, the esophageal epithelial layer is susceptible to infection, wherein the candida proliferates and adheres to the esophageal lining. Here are some pictures regarding the signs and symptoms of the oral candidiasis. At the left side, we can see a picture wherein there is a thick white plaque covering the tongue. It is actually the yeast-like fungus called candida. It is the one blocking the taste receptors of our tongue, which is causing the loss of sense of taste. At the right side, this is what esophageal candidiasis looks like. The white lesions can be found diffusely throughout the entire esophagus, or localized in the upper, mid, or distal esophagus, causing discomfort in terms of swallowing the food. Angular cheilitis can be characterized by bleeding, blistered and cracked corners of the mouth. If there is irritation or the irritation is strong, it would be hard for you to eat. The combination of wearing dentures and poor oral hygiene can be predisposed to the growth of candida. Just like the picture that you can see, wherein it is actually depicting the denture stomatitis.
To confirm a possible diagnosis of thrush, scrape the plaques with a tongue blade to show an irritated or bleeding base. Even though cultures are rarely mentioned, plaques can be cultured. Big, ovoid, and gram-positive yeast is easily detected with a gram stain.
Sections of the skin with candidiasis exhibit mostly spongiotic alternation in the epidermis along with the acanthosis that is irregular, mild spongiosis, and inflammatory change. Neotrophils in the stratum corneum and top layer of the epidermis are the distinguishing feature of the superficial epidermis. The spongiform postulation suggests that the neutrophils may form tiny collections that resemble impetigo or psoriasis.
The following pictures below, microscopic picture shows the comparison between the normal tongue, controlled normal tongue, and the tongue with oral candidiasis.